It is, yeah, one of the most common diagnoses that we see in our clinics. It's about 1 in 8 men over the course of their life will be diagnosed with prostate cancer. And about 1 in 40 men will actually die of prostate cancer. So this is a very common illness that yeah, we see every single day. There's a couple that I tend to focus on predominantly. So one is anyone with a family history of prostate cancer, and we're now into about year 30 of PSA screening, and so we're now kind of seeing a second generation of men who do know that they have a family history because their dad was screened or their dad was diagnosed with cancer. In particular, I like to focus on men who have a kind of a earlier onset of cancer. So the average age for diagnosis of prostate cancer is 66 years old. Okay. And the age increases as men get older. Okay. So the man whose father was diagnosed when he was 80, I'm not as concerned about necessarily. It's the guy whose dad was diagnosed when he was in his early 60s or his late 50s that's really setting off alarm bells that says we need to be screening this man. The other cohort that comes up is black men. And we don't know exactly what the biological factors are that contribute to this, but black men seem to basically have an increased risk at an earlier age of being diagnosed with prostate cancer. And kind of the rule of thumb that I've adopted is I generally will kind of recommend screening about 10 years earlier for black men overall. Okay. The last one that comes up is kind of odd because we don't usually think of them as connected, but men with a family history of early onset breast cancer in some of the female relatives or ovarian cancer. And there's common genetic mutations that lead to breast cancer in women or ovarian cancer in women that can also lead to high-risk prostate cancer in men. So those are kind of the three groups that in my history taking and in my counseling, I'd say, you are definitely someone that needs to be screened and consider screening at an early age. I usually recommend age 45 for black men and, and age 55 for basically white or Hispanic men.
The PSA, which is a blood test basically, so it's not invasive. It's a blood test that can be performed, and usually these conversations start with a patient with their primary care physician, and it's generally recommended starting on average age around 55 for most average risk people, not the people that Dr. Lewis was talking about. Yeah, the higher risk people, but the average risk people. And it's basically recommended to consider a conversation with your healthcare provider of the pros and cons of getting this blood test and screening.
PSA is kind of the test that gets people in the door. Yeah. But kind of circling back to that enlarged prostate discussion, an enlarged prostate can also lead to an elevated PSA. And so there's a lot of men out there walking around with elevated PSA levels who do not have prostate cancer. The PSA helps us identify the men who are at higher risk. And now we have a number of new blood and urine tests that can further risk stratify men and help us decide on if they need a biopsy or not. Some of the common ones that we use, there are at least a handful of additional blood tests that kind of give us a better risk stratification for the man with an elevated PSA. I use those commonly in my practice, and I would say probably about a third of men who come through the door with an elevated PSA, I can tell them they're actually at very low risk of prostate cancer just doing another blood test.